Hi, and welcome back to your Autism Game Plan. I'm Joya Vanderlaan, a family nurse practitioner, a functional medicine specialist, and an autism mom. Today we're going to talk a little bit about diarrhea. Last week we talked about constipation, and as you may know, sometimes your child may have constipation and sometimes they may have diarrhea, and hopefully most of the time they fall right in the middle. But with kids with autism, gastrointestinal symptoms are common. And because of that, many times when parents bring these concerns up to their medical providers, many times they're dismissed as, well, that's just part of autism. And I want to provide a different perspective. I want to give you some solutions and some things to think about when it comes to diarrhea and constipation in your autistic child so that you can offer them some more help. So I always like to start by asking, why? Why does the child have diarrhea? And one of the most common reasons could be food sensitivity. And food sensitivity can cause either a diarrhea or a constipation issue. So that can be kind of tricky. The other thing that can happen, and this can even be related to food sensitivities, is an imbalance of the gut microbiome. So for instance, if it's due to or caused by food sensitivities, those food sensitivities cause inflammation, then the gut microbiome is imbalanced. The other thing that can happen is it could be an infectious cause. In other words, there is a true infection going on. Maybe you traveled somewhere and you picked up something. Maybe it was, contaminated food, something like that. Those are typically going to be more severe bouts of diarrhea, and those you definitely want to get checked out and treated, because diarrhea can be pretty dangerous, especially the smaller a child, if you don't handle it properly. Diarrhea can be dangerous in some cases, as I mentioned, and it's important to know about these dangers so that you can look out for signs and symptoms of them. The biggest one that we worry about is dehydration. Your child, if they have diarrhea, is excreting, is getting rid of all this fluid out of their stool. Now, are they replacing it? So you want to make sure you're hydrating your child well, and there are various things you can do for that, which we'll talk about a little bit. Malnutrition, right? If the food is moving too fast through the system, that doesn't give the intestines a whole lot of time to extract nutrients from the food. So there could be some malnutrition. Sometimes constipation can be an underlying issue. And if you're curious about that, watch my video on constipation as I explain how a constipated child actually can be having loose stools. So you want to differentiate if it's true loose stool, true diarrhea, or if it's loose stool caused by a blockage further up or constipation. Other dangers are skin breakdown. So the more the child is going to the bathroom, the more A, they're wiping, or B, maybe they're not wiping well, and so some of the stool is getting left on the skin, which can cause skin breakdown. So you always want to make sure to keep the child's bum clean and dry as much as possible. And if you need to use some sort of ointment or cream to keep the skin intact and prevent it from getting broken down or rashy, then by all means do that. One last thing I want to mention about the dangers of diarrhea is that it can cause a behavioral pattern of stool holding in the child, which can then swing from diarrhea leading to constipation. Remember, if a child has had a painful bowel movement, the tendency may be to hold it in, which can then, again, lead to constipation, which we don't want. We want between 1 and 3 bowel movements per day, soft, easy to pass, no food particles in it, a good caliber. It shouldn't be snake-like and skinny. It should reflect the diameter of the intestine, of a healthy intestine. And above all, what I want you to remember is if your child is either constipated or is having loose stools, it's reason to ask why. It's reason for further investigation. It's a sign that something is not right. So let's get to the bottom of the problem, the root of the problem, and see if it can be addressed or fixed. Well, let's talk about things that you can do to help your child. And depending on your particular situation and the availability of a provider to you, you may either decide to do some stool testing, or you may decide to do some of the easy and safe interventions first to see if you can help your child before even having to go through the process of the stool test. So a stool test is helpful because it can show levels of inflammation, it can show different probiotic levels, different levels of bad bacteria, it can show how the child is digesting, it can show inflammation, it can show if the child is breaking down their fats and their proteins efficiently and absorbing the fats. And so it can tell a lot of things that can be really helpful in terms of knowing where to start with treating a child with either diarrhea or constipation, actually. We talked about dehydration and electrolyte imbalance being one of the dangers of diarrhea, especially the longer it goes on. So of course, one of the things you want to make sure, one of the most important things you want to make sure of when your child has loose stools or diarrhea is that you are providing hydration for them. Now, a lot of times they won't want to drink regular water. So there are things you can do, even adding a pinch of Himalayan sea salt, the pink salt, to their water, almost just enough that almost you can't even taste it. You could also make popsicles out of even plain water. Sometimes just that cold, icy feeling that they can suck on, and it's just a slower introduction of fluid into the stomach. Maybe they have a sensitive stomach. That can be helpful. You could make popsicles out of like a healthy juice. You can even add gelatin into juice and make popsicles, and then there's a little bit of protein in there as well. Coconut water tends to be a really good hydrator. The one thing I want people to watch out for, though, are the sugary electrolyte drinks that are often advertised as sports drinks or electrolyte replacements. While sugar is somewhat necessary in rehydration and certainly in energy production, especially when a child is maybe sick and not eating, you really want to make sure that there's not too much sugar in what they're drinking. In terms of foods that you might want to offer your child if they're having loose stool, you want to offer them ideally foods that are high in fiber and high in water. So even things like watermelon has a lot of water content. So if they're willing to eat but not drink, you may try something like watermelon. You also want to make sure that you're giving them foods that are a little easier on the stomach, because sometimes with diarrhea, you also may have an upset stomach. And so things like banana are really good. And again, you can make popsicles out of bananas, and sometimes that's more palatable and more preferred by children who aren't feeling well or who have diarrhea. You can cut the banana in half, put a popsicle stick in it, and then peel it, freeze it, and it's a really nice popsicle. I sometimes will enjoy those myself. You can also freeze other things like juices and waters and that kind of thing. Just make sure the foods that you're feeding your child are ideally fresh foods, not super processed, not super full of sugars and food dyes and all sorts of junk like that, because their system is already struggling. We don't want to add any more inflammatory potential by giving them foods that can cause inflammation or irritation. Try to follow the child's lead in terms of what feels good, what sounds good to them. Of course, you want to push fluids, but I typically recommend not pushing foods too much. When a child is having diarrhea, they have that really sensitive stomach, they may not want to intake too many foods. And for a few days, that's fine during an illness or something. Now, if the loose stool is longer lasting, as is common in children with autism, then of course you're going to want to make sure that they're getting proper caloric and macronutrient intake, so the carbs and the proteins and the fats. Sometimes probiotics are really helpful too. Remember, if the child is having diarrhea or constipation, many times that indicates some kind of imbalance. And so the intestines are reacting to that imbalance. And so many times a probiotic, a good, nice, strong probiotic, even sometimes a spore-based or a soil-based probiotic, is one of the big pieces that can help a lot whenever a child has either constipation or diarrhea, actually, because remember, balancing things out will help the intestines to function well again. Remember, finding the root cause over time, of course, is key to helping our children, whether it's with diarrhea, constipation, or anything else. So be an investigator, be curious, ask questions. Why is my child having these symptoms? And can you get to the root of it and fix them? And of course, remember, anytime the child is having loose stool, hydration is key. Thanks again for listening, and remember, be gentle with yourself. You're doing a great job.